Welcome to Dizziness Enigma, Diagnostic Criteria for PPPD. In this video, we unravel the complexities of persistent postural-perceptual dizziness, often a puzzling condition for both patients and clinicians. We will delve into its diagnostic criteria and much more. Persistent postural-perceptual dizziness, or PPPD, is a chronic functional vestibular disorder characterized by persistent sensations of non-vertiginous dizziness or unsteadiness, exacerbated by upright posture, self-motion, and exposure to complex visual stimuli. First described as phobic postural vertigo, PPPD is now understood as a distinct clinical entity, thanks to the Bárány Society's Diagnostic Criteria published in 2017. This reclassification has significantly improved our understanding and approach to this condition. Understanding PPPD is crucial for accurate diagnosis and effective management. It prevents misdiagnosis, reduces patient suffering, and guides appropriate treatment strategies, distinguishing it from other causes of dizziness. The Bárány Society's diagnostic criteria are the gold standard for identifying PPPD. These guidelines provide a structured framework, ensuring consistency and accuracy in diagnoses across different clinical settings. The official diagnostic guidelines require specific symptom patterns, duration, and exclusion of other conditions. Adherence to these criteria is essential for a definitive diagnosis of PPPD. Key symptoms include daily non-spinning dizziness or unsteadiness lasting 3 months or more, exacerbated by upright posture, self-motion, or visual stimuli. These symptoms are persistent and can fluctuate in intensity. PPPD symptoms typically follow a pattern where they are worse during upright activities, when moving, or in visually busy environments. They often improve when lying down, or in quiet, visually stable conditions. Common scenarios that exacerbate dizziness include walking through crowded stores, using escalators, or even watching fast-moving scenes on TV. These situations overload the visual and vestibular systems, triggering symptoms. Visual stimuli, such as flickering lights or patterned floors, and complex environments like open-plan offices, play a significant role in triggering or worsening PPPD symptoms. The brain struggles to integrate conflicting sensory information. PPPD is unique in its significant psychological, physiological interactions. Anxiety, depression, and other psychological factors can influence the onset and persistence of symptoms, forming a vicious cycle. While PPPD is a physical condition, psychological factors can amplify symptoms. Patients often report increased dizziness during periods of stress or heightened anxiety, demonstrating the intricate connection. The interplay between the mind and balance systems is crucial. The brain's interpretation of sensory input can be altered by psychological states, leading to a heightened perception of instability, even when the vestibular system is structurally intact. Differential diagnosis is a critical step in diagnosing PPPD. It involves ruling out other conditions that might present with similar dizziness symptoms, ensuring the correct diagnosis is made. Distinguishing PPPD from other dizziness disorders, such as Meniere's disease, vestibular migraine, or benign paroxysmal positional vertigo, BPPV, requires careful clinical evaluation and sometimes additional tests. The importance of ruling out alternative causes cannot be overstated. Misdiagnosis can lead to ineffective treatments and prolonged patient suffering. A thorough diagnostic process is essential. The implementation of standardized diagnostic criteria has significantly impacted the understanding and management of PPPD, bringing clarity to a previously ambiguous condition. Standardized diagnosis improves accuracy for healthcare professionals, enabling them to confidently identify PPPD, leading to more appropriate and timely interventions for patients. Furthermore, standardized diagnosis facilitates research into PPPD, allowing for consistent patient cohorts and leading to the development of more targeted and effective therapies, ultimately improving patient outcomes. In conclusion, understanding PPPD's diagnostic criteria is key to identifying and managing this often misdiagnosed condition. Its distinct features and the Bárány Society guidelines provide a clear path forward. We've journeyed through the enigma of PPPD, from its definition and diagnostic criteria to its psychological physiological interactions and the critical importance of differential diagnosis. By shedding light on PPPD, we aim to improve diagnostic accuracy, foster more targeted research, and ultimately enhance the lives of those affected by this challenging condition. Thank you for watching.